Hello, today I'm going to be presenting on electromyography for assessment of pain in low back muscles. So the purpose of this was to test whether fatigue indexes can accurately discriminate between subjects with and without low back pain. Pain is currently evaluated with subjective methods such as a patient's pain self-report, such as on a scale of 1 to 10. So the significance of this was that the results confirmed that EMG can be a useful tool in the evaluation of low back pain. There are over 20 scientific papers referenced in this study. References cover similar EMG studies, spinal mobility, muscle movement in different contexts, and EMG signal analysis. The references are thorough and directly relate to the research question presented in the article. There were 60 subjects who do not perform regular physical activity used in this study. They were split into two groups, one with low back pain and one without low back pain, each with 30 subjects. Interviews and medical history were taken by a physical therapist to recruit the subjects. The inclusion criteria for the pain group was multiple episodes of pain in low back muscles in the preceding 3 months. The inclusion criteria for the without pain group was an absence of pain in low back muscles in the preceding year. Exclusion criteria included previous surgery, symptoms of nerve root engagement, such as pain to the distal knee, and then spinal stenosis, inflammatory disease, and cancer. The study only looked at sedentary people in or around their 20s, so it was not representative of a large age range. As you can see in the table, the mean age was 27 for the with low back pain group, and then 23.7 for the without low back pain. But I didn't see any evidence of selection bias, and I didn't consider this selection bias either. For the protocol, subjects lay in a prone position with lower back, hips, and knees secured by a strap, and then a leather strap was secured at the shoulder blade. While in the prone position, subjects were asked to attempt to extend the trunk, causing isometric contraction of the lower back muscles. EMG activity was recorded in the L1 and L2 region of the spine, and the corresponding muscle groups are boxed in this picture. Disposable silver chloride surface electrodes were used, and a reference electrode was placed on the left wrist. There were 3 protocol stages. The first one was 3 attempts at maximal voluntary contraction, MVC, each lasting 5 seconds. A fatigue test maintaining calculated submaximal level of 80% of the MVC for 35 seconds was the second step. And then the last step was a post-fatigue test, which was also 80% of the MVC for 10 seconds to monitor recovery. The recordings were made with a 16-channel EMG, and then 4 signals were obtained by a load cell fitted with strain gauges. The subjects' rights were protected, and all subjects signed written informed consent, and then IRB approval was also obtained. Raw EMG data was submitted to the Butterworth band pass filter from 20 to 500 hertz. And then median frequency was calculated from a power density spectrum using fast Fourier transform. Linear regression was performed for each muscle from the MF values that were calculated or obtained. And the slope coefficient and the y-intercept from the linear regression were considered the fatigue indexes. Shapiro-Wilks and Levine tests confirmed normal distribution of the variances. Independent t-tests compared force and MF values between the groups. Wilks Lambda tests evaluated effectiveness of discriminant function in classifying subjects. And then one-way analysis of variance between the fatigue indexes of the 4 back muscles was performed. There was no significant difference determined, so the 4 muscles were considered a single low back muscle group. And the statistical tests performed do appear appropriate. Also, I forgot to mention the 4 back muscles there were 2, it was these 2, the L1 group and the L2 group on both sides. So 4 muscles in total. Discriminant analysis was used to classify subjects into pain and without pain groups using the fatigue indexes and MVC force values. 86.7% were correctly classified out of all of the subjects, and then 89.5% was the correct classification of subjects with low back pain. So these were great results. There were also significant differences found for the force values between subjects with and without pain. That was 505 newtons and then 678 newtons, respectively. Results were presented in a clear and understandable way in the article. The article used a lot of tables to organize all the values, which I appreciated. The study did discuss limitations, one of which was only using sedentary subjects. Previous studies had used only athletes, so I think they were just trying to go in the opposite direction and kind of see what the everyday person would be like in this scenario. And then subjects with lower back pain may not be able to exert their true maximal force, but I think that's also one reason for using this study. And then authors interpreted the results as an indication that EMG and fatigue indexes can provide a more reliable assessment of low back pain. So the significance of this study, some of the implications that I've mentioned before, the surface EMG and muscle fatigue indexes can be used as an objective tool for diagnosing and monitoring lower back pain. Using EMG could help standardize approaches to managing low back pain. The contribution to the body of knowledge, like I said before, it reinforces the ability of SEMG to assess low back pain, and it highlights the gaps in existing research, such as needing a more varied participant sample and using a more varied age range. The study could be replicated with a larger and more diverse sample size, and then replications could control trunk position and movement patterns to isolate effects of pain more effectively, because it wasn't always obvious where the muscles are being activated. And then additional questions I had were, how do muscle fatigue indexes and EMG patterns change over time? And then how does regular physical activity influence muscle fatigue compared to sedentary individuals? These are just things I was curious about that weren't really addressed in the paper. But that is all I have. Thanks for listening.